Greetings, NARA Nation. Leigh Ann Frick with Care Navigation Consulting. Wanted to talk to you today about the contents of the Medicare Physician Fee Schedule proposed rule for calendar year 2023 that was released late in the day on Thursday, July the 7th. This document is 2,066 pages long, and it includes a lot of information today, but we will just focus on an overview of those items that are most pertinent to us. We will discuss payment for CPT codes, telehealth services, an update to some of the RTM codes, direct supervision conducted virtually in private practice, and a little information on MIPS. So we'll start our discussion with payment. The proposed conversion factor for calendar year 2023 is 33.0775, which is down about 4.42% from the current conversion factor of 34.6062. Remember, those are the dollar amounts multiplied by the RVUs to get payment by for each of the codes. We all remember that 3% bump Congress passed at the end of last year for calendar year 2022. Well, that expires come December 31st. So that accounts for 3% of that 4.42% reduction. So in addition to the 4.42%, there are some changes to RVUs that, depending on your practice patterns, may create, and code usage really, may create further payment adjustments, but it's really hard to kind of estimate those, not knowing which codes are most relevant to you. On the telehealth front, CMS is proposing that CPT codes 97150, 97530, and 97542, those are currently on the Medicare telehealth services list on a temporary basis for the PHE, but CMS is proposing that they should be added to the list through the end of calendar year 2023 on a temporary category 3 basis to allow time to gather additional information and data that could support adding them permanently. While there is some legislation out there that could add us as therapists to the list of eligible providers for telehealth, until that happens, currently per the Consolidated Appropriations Act of 2022, we are only going to be able to use and be reimbursed for telehealth for 151 days after the PHE has ended. So follow the legislation and advocate appropriately. On the RTM code front, I'm not sure we've really figured out the clear use of these codes yet in now July of 2022, but CMS is proposing some changes for calendar year 2023. They want to create 4 new G codes to replace the 98980 and the 98981. The new HCPCS codes would be specific to the provider delivering the service. So 2 of them would apply to situations where a physician or non-physician practitioner is providing the service, and 2 of them would apply to a non-physician qualified healthcare professional, such as a therapist. So if adopted, the current codes of 98980 and 98981 would become non-payable for by Medicare. There's also a new CPT code for cognitive behavioral monitoring, 989X6. That full number will be published in the calendar year 2023 CPT code book that should come out this fall, probably September-ish. In addition to that one, there are 2 new chronic pain management and treatment codes. While it's still unclear whether therapists will be able to actually bill these codes, at the very least, they should facilitate care coordination and possibly increased access to therapy for patients with chronic pain. So definitely see those as a plus. Unfortunately, CMS did not take this opportunity to permanently change the required direct supervision of an assistant in a private practice setting to include the ability to achieve this through that virtual presence using real-time audio video technology, as we have available to us now during the PHE. It is important to note that we will have that mechanism available to us through December 31st of the year in which the PHE is declared over. However, CMS does want and is requesting information on whether they should make that flexibility permanent. So there's an opportunity for you to provide your thoughts and insights to CMS. On the MIPS front, again, no major changes around eligibility, the weighting or the completeness requirements. Those are pretty much unchanged for calendar year 2023. And the exceptional performance adjustment will not be included going forward starting 2023. However, CMS is saying that they want to end the interoperability exemption come 2024. We're not sure that that would really be hugely impactful for us, since many of us still qualify for the small practice exception, which would maintain exemption from the promoting interoperability category. But know that interoperability is a hot topic. The MIPS value pathways are coming, but will not apply to therapy initially. And there were some changes and additions to some of the quality measures. So check those out if you are participating in MIPS. Again, this proposed rule is 2,066 pages. These are just the highlights. We do ask that you submit individual comments and requests for information on any of the aspects that you can. Remember that those are due by September the 6th. Please get involved and stay informed. Advocacy is the answer, and we thank you for your time today.